Hello, hello. Welcome back, wonderful technologists. Welcome back to the CT Educator podcast. Hope you guys are having an amazing week. It has been a very exhausting, long week for me. My goodness, I've been working just a crap ton of hours and just trying to get some stuff on my business and courses. Like, I'm fucking busy. And on top of, being a mom and motherhood and everything, I am just freaking busier than busy. It is fucking ridiculous. So, yeah, it is a nice sunny day here, and the weather is getting warmer, and I'm super excited about that because me and the kids, we gonna be outside, let me tell you. So I cannot wait for it to be 80 degrees and just enjoy that for the summer because my kids only have like 20 some odd days of school left. So this is interesting. Now I have to figure out how to entertain them after that, right? So, in today's episode, I am continuing with this series that I'm doing that is leading up to the 2 to 3 day challenge. I haven't figured out how many days I'm going to do with this challenge, considering my work schedule, of being the go-to CT tech. So, if you haven't checked out the details of that challenge, make sure you check out the link below in the show notes. It is going to be probably a 2-day challenge where I will give you the ins and outs of how to be a go-to CT tech, even if you're new, you just started out, you're a beginner. I am going to give you some awesome strategies in those 2 days that are jam-packed. I'm going to be teaching it live, so make sure you get on the link. I am going to drop the challenge probably in the first week of May. So the very beginning of May, I think it's May 2nd and 3rd, that's when we are going to start that challenge. It is going to be on my Facebook page, the CT Educator. I will be teaching that live. So make sure you check out the link, get in on the challenge, get on there, and get your butt in there, okay? So in today's episode, we are going to talk about the A to Z for CT techs. So we're going to be mastering your skills with 4 simple strategies. Now, I know I talk a lot about when you're a beginner and you're brand new. It's because I feel that we need to just improve the education, the training of those new techs that are coming in and that are eager to learn. So it's super important to know that we direct them in the right path, going towards the right direction so they can be successful wherever they decide to work, whether it's outpatient, whether it's in a trauma hospital like myself, whether it's in CT applications, whatever it is, whether they want to travel, because there's a lot of traveling positions out there. So it is our responsibility as those experienced, seasoned senior techs to make sure that our new beginner techs have everything they need so they can master their skills like the badasses they are. Okay. So one strategy, I'm going to give you 4. One strategy I'm going to give you right off the top is you, the new beginner that is listening to this episode. If you're new, you have less than a year in, even less than 2 years in, or you just started, you came from X-ray, you started, I want you to take away these 4 strategies in this episode. So the first strategy I'm going to give you is make sure that you get to know the layout of your CT scanner and the operator console. You need to know where all the buttons are. You need to know how to select protocols. You need to know how to initiate the exposure, tilt the gantry, move the table in and out. Those are things that are super important when it comes to knowing how to execute that exam, okay? Very important because I think when they start out in the clinical site or when we get a new technologist from X-ray, a lot of the times we failed to do that. We just say, oh, well, you do this and this and this. No, we have to take it step by step to make sure that they understand how to operate that machine and how to operate behind that computer to select the proper protocols to make sure that they execute the correct exam and an optimal exam. Okay. So that goes into the next strategy I'm going to give you is how to optimize your scan parameters. So what do I mean by that? What I simply mean is know what pitch is. So what is pitch? Pitch is how fast or slow the table is moving. That correlates with your KVP, your MA, and your scan time. So scan time, rotation time, how fast the X-ray tube is moving. Your slice thickness, whether it is a thicker slab or a thinner slab, depending on your protocol. Now, we all know that if we're doing IACs, we know that we are going to scan either in a 0.6 or a 1 millimeter increment because we want to see that fine detail of everything in the inner ear. Versus if we do an abdomen and pelvis, of course, we're going to do a 5 millimeter cut because we want to get through the body part quickly. And a lot of times the patients can't hold their breath very well, right? But you have to understand those scan parameters and know how to optimize it in case of, okay, this patient is 470 pounds. You know that you need better detail and you need more penetration power when it comes to that X-ray tube. So you either have to adjust either your MAS or you have to adjust your KVP. You don't adjust both. Let me say that again. You don't adjust both because that's not going to give you the results you want. So we know that when you position the patient properly and you take that scout, it's going to calculate a MA that the system says, okay, this is where you center the patient. This is the expected amount of dose that the scan is going to give the patient. So understanding those parameters and how it affects your image quality, how it affects your radiation dose, and affects your scan time. Now, let me give you an example. If you slow down the pitch, that means you have a slower moving table. You're going to increase the dose to your patient because it's longer, and you're going to increase the scan time too because it's longer that the table is taking to get through the body part. Whether if you have a faster rotation time, it's going to get through that body part a lot quicker and reduce the dose to that patient. Now, we do have, the back filtration where it does clean up all those images, via algorithms and kernels, depending on what CT system you use, to make sure it gives you the best optimal image when it pops up on the screen. Okay. So when I say patient positioning is everything when it affects your scan parameters, which goes into my third strategy, which is mastering patient positioning. I know I have talked about this on multiple podcast episodes, so make sure you guys go back and listen to that. Patient positioning is crucial. It affects everything as far as image quality, radiation dose. It affects those two things directly because you have to make sure that when you're using that laser light, you are iso-centering and make sure you're centering to the Z axis to the patient. Those are very critical and it's very vital for any quality image exam that is going to be optimal. And also, we want to prevent motion artifacts. So how do we do that? Well, we have a lot of techniques that we use. There's table straps, there's pads, there's wedges, things that will decrease the mobility to the patient. Also, educating the patient, make sure that they understand that they can't move. So communicating with the patient is a huge part, and it has to be done in order to get that high quality scan. You need high quality image. I mean, what's it going to look like when you don't instruct your patient to hold still, all of a sudden they're moving all over the exam? Then you have to radiate them for a second time, which increases their dose even more, right? So proper education on breathing instructions, telling the patient to hold still, and those immobilizing devices also keeps them safe on the table so they don't fall, but also keeps them still so that you can get that optimal exam for them, right? Now, the last strategy that I'm going to give you is image reconstruction and your post-processing. These are very important because we do a lot of post-processing when it comes to CT. So how to change your image contrast, how to change the window levels, how to manipulate what that image is going to look like. Make sure it's in the right window level and window width. So the radiologist can see all the tissues and make a proper diagnosis. The use of MPR, okay, so multi-planar reformats. The use of MIP, so that's your maximum intensity projection. To use your VR, which is your volume rendering, so you can create those 3D images, not only for diagnostic purposes, but for surgical planning and anything else that the patient needs. So, image reconstruction, you have to know how to change your different window levels and window widths so you can get the correct image contrast on that screen and make sure that it's in the correct window level. So let me give you an example. When we do abdomen pelvises, yes, we have a abdomen window that is a soft tissue. And then if they like a long view, we do a long, a long window width and window level, right? Where we have a CT of the brain. We have the brain algorithm, okay, which sees all the soft tissue of the brain and all the anatomical structures, right? We also do a bone window because they like to see if there's any fractures, anything that's abnormal when it comes to the brain, any weird shapes, things like that. So you have to know how to change those and how to manipulate them and how to create those 3D images, such as a sag and coronal, because that's what radiologists like, to create that VR where you have just the vessels for, let's say, a dissection protocol, to make sure, or if they have an endograph or they're getting worked up for some type of endograph, to make sure you know how to reconstruct that 3D from, of course, your thin data set. Okay. These are just some points as the A through Z, as a technologist, as a brand new technologist, and even if you're seasoned, you should have these techniques down to a science. Now, if you're new, of course, it's going to take some time, and give yourself grace, because you know what? Within time, you're going to gain you're going to get it with experience and repetition, right? Now, if you want to dive deeper into any of these concepts, I offer an awesome coaching program where I will coach you for 6 months to get you prepared for the CT registry. And I give you all the step-by-steps. We create goals. We just tackle what you need help on when it comes to your CT training. So if you want all that information, everything is linked in the show notes. So make sure you check it out. Okay. Make sure you also check out the challenge. It's 2 days, jam-packed, of how to be the go-to CT tech. So I hope these 4 strategies were helpful in just helping you in your training and getting you just a little bit further ahead so that you can be the best technologist you can. All right. So that is it for this episode. I hope this was insightful. Like I said, check out my coaching program, check out the 2-day challenge. We're going to be doing some really exciting stuff. Got some really exciting stuff coming in the works. So head over on to Instagram, give me a follow. Make sure you share the show, like, follow, subscribe. It always helps. And hopefully that this will make an impact and help somebody out there that is struggling with their CT training. So hope you guys have an amazing week, and I will chat with you next time.